I'm so happy to be having this interview with Dr. Nicole Cozine with Pelvic Sanity. You are my interstitial cystitis, pelvic bladder pain person. So any questions that I get, if I can't answer them or I don't have a post on it, you have so many resources on your account. I'm like, go look at Pelvic Sanity. Go look at Pelvic Sanity. Yeah. I love all your IC myths and everything that you've done.
Yeah. I am so into myth busting. So thanks so much for sharing all that stuff.
Yes, I am a fan and also love your book. So yes. Absolutely. Thank you for all the work that you've done. And just give us a little bit of background about yourself and your clinics for those that may not know you.
Yeah, so my name is Nicole Cozine. I am a pelvic health physical therapist, and I've been one for about 14 years. I have a brick and mortar clinic in Orange County, California, which for those who don't know, it's halfway between Los Angeles and San Diego. So we're smack dab right halfway between there. And we have 4 physical therapists plus myself. So we have 5 people and it's just awesome. So, we are treating men and women with pelvic health conditions. We do remote consultations. We do all kinds of cool stuff.
Yes, yes. And I just want to also give a shout out. You have an intense program, right? So like for people that live out of town, if they have gone to other pelvic therapists or maybe they haven't, but they are looking for a solution, they can come from out of town and you have a special program to help work with them for a week or 2. Give us a little bit of information about that.
Yeah, so it's been really actually kind of cool. And since we wrote the book, we've actually been seeing quite a few people with IC, and then we get a few people with pudendal neuralgia and stuff too. But this is an international account with my pelvic floor muscles, and we've seen people from, I think we're up to 6 continents and over like 20 different countries. So yeah, so we have what we call like our pelvic intensive, and so we can either do a 1 week, a 2 week, or a 3 week program. So this month alone, we have people coming from Oregon and Australia and I think San Luis Obispo, which is like about 4 hours away from us. So it's great. Yeah, and we can give people like, we obviously can't promise to fix everybody's problems, but in that amount of time. But what we can do is give a lot of direction for people that don't have access either to a pelvic health physical therapist or they do, but it's been a little bit not real targeted, or they're having a trouble getting the results that they want. Then we can help to sort of, just get a second opinion essentially, and then like target the treatment and then help them go back to their practitioners where they're from with some more guidance. So it can work really well.
So pelvicsanity.com.
Yes, totally. And then, that's been
and then your social media accounts and so forth. But the pelvicsanity.com has a lot of good resources. I've visited it several times. And so any questions, go there. Awesome.
Perfect. Thank you so much.
Yes. Okay. So let's jump into interstitial cystitis. That's a mouthful, by the way. Like, say it fast 5 times.
I know,
especially
right?
if you add in the word solutions, interstitial cystitis solutions.
Like the best kind of alliteration, but not really. So
what is it?
Cystitis. So it is what we used to think it was only a bladder condition. We have now sort of categorized it more as a pelvic pain condition with bladder symptoms. And so it's also known as IC. Some parts of the world will distinguish between interstitial cystitis and bladder pain syndrome or painful bladder syndrome. But the reality is that it's a diagnosis. Both of them are diagnoses of exclusion, meaning that there's really no one test or thing that you can like point to where it says, oh, you have IC.
We can't run a lab test. We can't run a lab test to say this is IC or
this is IC, right? And so we need to do a bunch of tests to rule out other conditions, and then based on your symptoms, you might end up with a diagnosis of interstitial cystitis or bladder pain syndrome. The possible exception of that is when with 10% of people with these symptoms, you have what's known as Hunner's lesions, and those are actually like diagnosable
can see those
ulcerations or wounds essentially in the bladder lining that you can see on a what we call cystoscopy. We'll get into like how to test for stuff. But that's a little camera that goes up your urethra into the bladder to actually look in around the bladder and then see, right? So that would be like the urethra, it goes up there, and then there would be like a little tube that could basically look at the inside of the bladder there. So, and if they see certain characteristic ulcerations, then you can get diagnosed with interstitial cystitis with Hunner's lesions. And that's about 10% of people with bladder symptoms that could be having interstitial cystitis symptoms have those we call them lesions. I don't really like that word because it's a little bit scary, but those things in the bladder lining.
So what are some of the common symptoms that people might have with interstitial cystitis?
So this is where it gets a little bit common, right? Because there's a lot of overlap between things that you can have with interstitial cystitis and things that you can have with other conditions. But the two major characteristic things to get the true diagnosis of IC is both urinary symptoms of urinary urgency and frequency, so meaning you're either going to the bathroom a ton or you have a really strong, kind of abnormally strong urge to urinate, accompanied with the second thing is having some sort of pelvic pain. And that's a broad region, but you can have abdominal pain, urethral pain, pelvic pain, groin, but any sort of pain basically from your belly button to your thighs would be some sort of pain associated with going to the bathroom frequently or urgently. And those are the two hallmark signs of a diagnosis of interstitial cystitis.
Okay. So let's say someone goes into their provider and they have both of those things. What can they expect?
So if they have both of those things, this is where, it's super variable.
That's such a trick question. I'm sorry.
It's okay, but I think it's important, right? Yeah. It's super variable. If you go into your provider, your physician, your urologist, your urogynecologist, it's going to be really variable what they come out with just those two symptoms. You could come out with a UTI diagnosis, but you don't really have a UTI. You could come out with, you have IC, oh no, this is terrible, incurable condition. You could come out with, I don't know, you need to go and see other kinds of things. We might call it IC, we might not. So I think that's a really frustrating thing for patients a lot of the times is that and because to their credit, right, it is a diagnosis of exclusion. So sometimes they want to sort of wait and see before they slap a label of a condition on you for that, especially because, right, if you have something also like endometriosis accompanying the interstitial cystitis, then that can create pelvic pain and urinary urgency, right? So it's one of those things where sometimes you just have to be patient at a time when you don't want to be patient, right? Because you want something to explain the symptoms. And sometimes, and this is where we can talk about the pelvic floor, because sometimes what's happening is that the pelvic floor is the common denominator that can cause pelvic pain, can cause urinary urgency frequency, can cause abdominal pain. And then at that point, we want to treat what we can treat anyways. And so the appropriate thing to do is refer to a pelvic physical therapist, continue to be followed for medical management by a physician, and we can work together to sort of see, can we get those symptoms down? And then what does that tell us about what your condition is? Does that kind of make sense?
Yeah, absolutely. So kind of to follow up with that, like what would be your ideal scenario for how a provider might handle somebody coming in with pelvic pain and urinary urgency and frequency? And when would they refer them to pelvic therapy? Would they need to do some things first or go straight to pelvic therapy?
This is a really great question. I think that from a pelvic physical therapist or pelvic physio perspective, I want to see you sooner rather than later. And I think that some of the testing that they can do in the medical office can be done concurrently with physical therapy. So I think it's important to definitely rule out an infection, right? Which for interstitial cystitis, those first symptoms can really feel like a UTI. And so to make sure that we get not only the dipstick urine culture, but an actual culture to make sure that nothing is growing, and if it is, what type it is and all that stuff. But at the point when that's been said, no, you don't have an infection, or you do, and here is the remedy for that, but your symptoms persist.
They don't get better after the antibiotics.
They don't get better after the antibiotics, then I want that to be an immediate referral to a pelvic health physical therapist. And that does not mean that you have to stop seeing your doctor. We can do those things concurrently and work together. And I think that's a little bit of a misconception sometimes from the medical side, with the way that their minds work, where they want to like make sure that we've done all of the
X
things.
needs to happen before Y, and then Y needs to happen before Z.
Yes, and that's just the part of their training. But at the end of the day, for a musculoskeletal thing, or the muscles and nerves that need to be addressed with us, that we want to get to those things sooner rather than later. So to make sure that we can sort of nip stuff in the bud, make sure we don't get into some big pain cycle. So we want to make sure we address that concurrently with your physician. So ideally, we would want that to happen immediately.
Yeah. Good.
And just FYI, the American Urological Association guidelines, which are basically the guidelines that the urologists should be using, that is pelvic floor physical therapy is the first thing on the medical line of treatments that should be happening. So that should be in a simultaneous conversation with some of those first medications and installations and all those things that most people think of with IC. Pelvic floor physical therapy is in that same line of treatment, so it should be administered at the same time.
I love it. Yes, yes, yes.
Yes,
okay.
yes.
So what are some common treatments that are not physical therapy oriented? So what might a patient expect from that standpoint?
Right. So the medical treatments that your urologist or urogynecologist can provide when you're having these interstitial cystitis symptoms are things like installations, which is where you actually, through the urethra, can actually put medication into the bladder itself. Sometimes that's a analgesic or a pain medication. It can be a anti-inflammatory medication to help the lining of the bladder get calmed down. And so there's installations, there's medications, and there's a whole list in the interstitial cystitis solution of medications that a lot of physicians might not think of. There's only one oral medication that is approved in the United States to be used with IC, and that medication is called Elmeron, and we can get into that in just a little bit. But there are some pros and cons with that, and so there's a ton of other medications that can be used that aren't specifically for IC, but can help the symptoms of IC quite a lot better actually than Elmeron. So there's those types of things that you should talk to your doctor about, but there's a lot of choices to help which symptoms are your primary symptoms. If it's pain, then we want to go more into that realm. If it's more of the urgency, frequency of urination, then we want to maybe try more bladder-centered treatments with your physician. Yeah, but those are like kind of the big ones.
What percentage of people with those symptoms also have pelvic floor dysfunction?
Ooh, good question. The research shows that up to some research is like 85%. I've even read up to 90% of people. That's almost everybody, you guys.
Almost everyone. So if you're having painful bladder and urinary urgency and frequency, we can help you.
90% likely that you also have pelvic floor dysfunction. Now, one of the biggest things that I want to get across today for everyone is that might not be 90% of your symptoms, but it also could be. And so I think some of the goals of pelvic physical therapy is to help eliminate, like control what we can control, right? Help eliminate that the pelvic floor as a possible trigger to your symptoms. So, and if for a lot of people, that's almost all of the symptoms. And for some people, it might only be 30-40% of the symptoms, but 90% of people do have pelvic floor dysfunction. And so that's really can be helpful to get the muscle part taken care of with the pelvic physical therapist or pelvic physio, and then you can sort of start to see, well, where else do I need to go? What other medical thing, what other stress thing, what other things are contributing to those symptoms now that we've got the pelvic floor under control, which sometimes takes a little bit more time, but I think that that's a really big area that people miss quite a bit because it feels so bladder. It feels like it's your bladder, but the reality is it's usually not coming actually from your bladder. And I love the phrase that Dr. Kenneth Peters talks about, and I quote it all the time, but a lot of times with interstitial cystitis, it is the bladder is such an innocent bystander to a larger pelvic pain process that we really have to address all of those other things in order to get the bladder pain to go down.
That really is a nice analogy.
Yeah.
You can see it. You can see the bladder just standing
there like, you know, it's like
don't
getting
inject me.
All these other things, you know, and the only way that your bladder knows how to tell your brain that there's a problem is through either pain, I hurt, or I have to pee. And so that's where you can get some of those false urges where your bladder's just trying to tell you, hey, there's a problem down here. Can you help me out?
Yeah.
And that's why sometimes you get those false urges or bladder spasms, because it's just a message of your bladder's trying to tell your brain that there's an issue down there, but it can't differentiate between pelvic floor and true bladder or uterus or anything else. So
scar tissue, right? Whatever.
Yeah,
so many factors.
Exactly.
We have so many questions, and I know we're not going to get to all of them, but I'm going to jump around here a little bit.
Okay.
So what about Botox?
Botox. Okay, so there's two ways if you have urinary urgency and frequency and pelvic pain, there's two different ways that Botox can help. You can either have your doctor do Botox to the bladder itself, where there's a little muscle that actually is in the lining of your bladder. So they would actually
round.
Yeah, and the thing and when that starts to do a little bit of squeeze, right? That creates to your brain, I have to pee. That can be overactive in somebody with interstitial cystitis. And so you would do Botox actually to the bladder muscle to help it to fill more. So that's one way.
And this is not a muscle that we can control. This is
yeah, so it's a muscle that is under our involuntary control. That's happening because we're wired.
You don't tell it what to do.
Right. So that can be helpful sometimes. It's also kind of on down the line of things that you'd want to consider. That's definitely not something you'd want to go to first. But it's definitely something you could do a little bit later into your treatment plan if nothing's working. And then the second way to do Botox is actually into the pelvic floor muscles of the pelvis. And so that's where you would actually...
The pelvic floor wraps around the outlet.
Yeah.
Good, you have a model.
Yeah, so the pelvic floor, so then you would be injecting the Botox into each of these, and some of these guys actually wrap around the urethra, which is what Janice was just showing. And so with
where the pee comes out.
Right, where the pee comes out. So that can sometimes that can be beneficial if you're having a hard time with your therapist, with your pelvic physical therapist, if you're having a hard time getting those pelvic floor muscles to relax and stay relaxed, that's where sometimes the Botox lasts for about 3 months, and you can actually get a lasting effect of those muscles to relax. So again, that's not something that we typically do right away, but it can be a tool that you can talk to with your pelvic physical therapist and your physician to make sure that we're concurrently implementing those Botox interventions if we are concurrently with PT. That's in the research, it showed that with Botox to the pelvic floor, that's the best combination of the two, right? Because it's, even though the medication can help the pelvic floor not to contract, we still need to work on all of the other things around that and at the pelvic floor to get that lasting effect beyond just when the medication stops working.
Right. Very good.
Yeah.
Great information. Okay, so is there a person that is more likely to get interstitial cystitis? Are there some risk factors, or how do we avoid it?
How do we avoid it? Yeah,
I guess that's like 5 questions in one.
Right. So I would say that taking care of your pelvic floor health can help to be less likely that you would get those symptoms. There's really no way, we don't really know what causes interstitial cystitis yet, except for, so there's not one thing. If you do this, then you're more likely to get IC. But what we do know about IC, based on some really recent good quality research, is that it's basically 3 things. It's a pelvic floor muscle condition. It's a nervous system where the bladder brain connection is a little bit faulty for the time being. It's off. It's getting triggered too quickly without a true filling of the bladder. So that's the nervous system component. And then there's a little bit of a bladder component, right? So, and more so for some people than others. But really the pelvic floor, nervous system, and bladder all need to be addressed simultaneously, in my opinion, in order for those pretty severe interstitial cystitis symptoms to lessen and lower. So there's not anything necessarily that you can do to prevent it other than just make sure that your pelvic floor is all good and then make sure that you're using proper toileting techniques and stuff. But again, not to say that just because you're being all good with when you use the restroom and how much water you're drinking and stuff, you can still have IC with that too. So so I don't say that to be scary in any ways, but it's I think the bigger thing to note is that if you get diagnosed with it, or if you think you might have IC, it is not the end of the world like you might read on the internet. There's a lot of people that can help you, and the quicker that you get the symptoms under control, the better it's going to be in the long run.
Good. Yes, there's hope and help. Don't just
totally. Hope.
Okay. Yes. So these next few questions do kind of go together. So what can I expect from pelvic therapy?
Okay.
There's no pelvic therapist near me, and what's the best resource under $25? So starting with the best case scenario is seeing a great pelvic therapist. What can we expect? And then what to do if we
can't find one. Okay. So what to expect is that your pelvic physical therapist should, number one, be very, you should look for somebody that also treats pelvic pain conditions very well. There's, in our pelvic physio world, sometimes there are people that focus a lot more on just like postpartum health and women's health only. And sometimes those people can be great pelvic pain specialists, and they have that also. And sometimes they really don't have a lot of expertise in the pain world. So I would double check to make sure, and that's just a phone call and ask, like, do you typically treat people with pelvic pain? And what you should expect from your physical therapist is a very thorough evaluation, which involves both external factors. So they look at your back, they look at where all of the nerves come out from your back down to your pelvis, at your hips, all the way down to your feet, all external, and then to add in the internal evaluation of those pelvic floor muscles, where we're actually looking at or feeling through the vaginal canal or rectal if you're male or female, all of these muscles around the pelvic floor. So it should be a combination of internal and external evaluation and treatment, and somebody that knows that is comfortable treating pain conditions. And again, that's an easy just phone call, to their office or looking at their bio on the website and stuff.
Yeah.
Um,
Yeah.
If
and then ultimately listening to you, right? And addressing your symptoms. So if you've been there 4 to 6 visits and you're not having any resolution and they don't seem to be listening to you, those are some warning signs.
Totally. And I always tell people that you have permission to change providers and get a second opinion. There's a ton of us nowadays that are doing remote consultations. So you don't even have to physically travel to go see. You can get sort of like, hey, does this sound right, Miss IC expert, right? We get those calls quite a bit. Does this sound right? And then sometimes it's just like, yeah, take this information back and guide the physical therapist in your area a little bit more to maybe open up another avenue of treatment that they weren't thinking about before. Very commonly we get questions about, is my bladder pain and my hip pain related? And that answer is yes. So we should be making sure that you can see a physical therapist that can treat both of those things, or at least is helping to get you your hip help and the internal help simultaneously, just to give an example. Mm-hmm. We like it to be one-on-one with the physical therapist. So most public health places are one-on-one. We see patients for an hour. I feel like for the kind of more complex pelvic pain conditions, the more time you can spend with your one-on-one with your pelvic physical therapist, the better. So that's another thing to look at is if you're really only getting about 15 or 20 minutes. I just talked to a gal the other day on the phone that was really only getting about 15 minutes of time with her pelvic floor physical therapist. Then sometimes that's not quite enough to really dive into the reasons why the pelvic floor can be involved in those interstitial cystitis symptoms. So it's just something to look at and make sure that you're comfortable with that. They should also be part of a multidisciplinary team. So your physical therapist, if we work with pain management physicians, urogynecologists, psychologists, acupuncturists, like they should be a good little network where they can help guide you where the best help can be from another discipline. And then you should just feel really comfortable with them. And don't be afraid to change or ask questions about what they're doing and why, because there should be a very good dialogue between you and your pelvic physical therapist about your treatment, about your progress. So I get a lot of questions too about how long should it take and all this. And that's so variable. So it's hard to answer. But a good guideline, I think, is that you should be seeing some sort of change or a glimpse of like, ooh, that's different.
Yeah, exactly.
In really 4 to 6 visits.
That is exactly what I say, 4 to 6 visits.
Yeah.
We're on the same page. Yeah. You don't just see people.
Symptom resolution, it can be it could be way longer time. Right. But we should be.
You're on the right track.
Yeah, feeling like, okay, well, we're at least working towards something and we're seeing some changes. Even if your pain is moving we should at least see that it's changing. So I think one of the other big questions that I get with pelvic physical therapy is, well, now that one part of my pain is better, something else is actually worse, or the pain is in a different spot. And that is totally normal and totally expected. But your physical therapist, your pelvic physical therapist should have an idea that's going to happen and an explanation for why that is, and then to sort of treat around that new area, because that should give us clues as to what's happening. So,
yep. Okay.
Now,
now the other pieces, like no pelvic therapist near me, and is there a resource that you could recommend? I know what it's going to be. Well, I know what it is for me, but please answer.
Right? So, okay, this is a great guide. It is a great guide for you to be able, there's some self-help things in there. There's a really good guide on what you should be asking your doctor to do. So even if there's a doctor that doesn't know about interstitial cystitis or a pelvic PT that doesn't really treat interstitial cystitis around you, they should be able to get some good information from this book and try to help use their knowledge of their degree and then be able to combine it with this. There are also some really good, more robust online tools to help find a pelvic PT in your area. There's new people popping up every day. So I know, Janice, you guys have a good
like a find a PT.
Find a PT section. There's ones on, we actually wrote a blog post. We can maybe do some sort of.
Yeah, we can link it. We can link it.
Yeah.
I think I saw it because you have links to, you have links to several of the databases.
Yeah. And actually, I don't think we have to rewrite it because yours isn't on there. I don't think it existed.
Well, so our site is basically links to these databases. We don't have our own directory, but we're linking. So right now we have 4 database links, and we just learned about another database with more therapists. So mypfm.com is an option.
Awesome. So mypfm.com, Pelvic Guru has a really a global sort of thing. There's also in each organization. So usually like the Interstitial Cystitis Association has Find a PT, Interstitial Cystitis Network has Find a PT in your area. I think the biggest, some of the frustration with those kinds of things. So from a patient perspective, you really have to.
Where do I go?
And you have to cross-reference lists.
Yeah.
So you have to look at one list and then look at another list and look at another
list.
This
person on all these lists.
And basically,
and then as a provider going to sign up to remember, okay, well, I know I'm not on the ICS,
right.
So,
and
but I'm on the APTA,
right. Sometimes they're not free and sometimes it's a membership-based one. So there's another one that, the section of women's health in the United States is a great one, but you have to be an APTA member to be on that list.
Right.
So just as a patient looking for people, just make sure that sometimes there are stipulations to be on those lists that somebody might not have, which is why you got to look at multiple ones. There might be somebody in your area. And then the other thing is that I tell people all the time is that call your local orthopedic physical therapist, because a lot of times those are more people around, and say, hey, do you know of a pelvic physio there as well?
That's good. Very good. Excellent. Yeah. Okay. Let's see. I mean, we've talked about a lot. Is there, and I know we're nearing our time limit. So is there anything else, anything that you'd like to share that we haven't covered?
Ooh, gosh. Let's talk really quick about the, sometimes the other conditions that are usually associated with IC. The biggest ones is endometriosis. So there is sometimes that's called the evil twins, right? Where you have both endometriosis and interstitial cystitis, and both of those symptoms can overlap quite a bit. Another really common condition to have with IC is IBS. And so
irritable bowel syndrome.
Irritable bowel syndrome. People that have allergies and asthma are actually at increased risk for interstitial cystitis, mostly because we think that there's like probably an overactive of the inflammation histamine response that's going on there. So that's why some of the medication lists can actually be antihistamines that can help bladder pain, which is another one of those ones that you don't really think of necessarily, and your doctor might not be thinking of as like a go-to, but you can do that. And the bottom line is that all of those other conditions can also have pelvic floor component to them.
Yes.
Right? So it's just, we of course have biased opinions on the fact that we're so important as an integral part of the team. But you guys, patients, you guys got to get to it.
Yes. I mean, the pelvic floor is so important.
It's so important.
Is it, like how well do we take care of our oral health? We are taking care of our oral health daily, if not multiple times a day. How much time do you spend on your pelvic health? How much money do you spend on your pelvic health? So,
and and there's also a really interesting study that showed that if you've had an abdominal or pelvic surgery, you're also sometimes more likely to get an IC diagnosis in the years following. So people that have had a hysterectomy or even a C-section, because of how close the bladder sits here to the pubic bone, and a lot of times we're cutting here to get into for a gynecological surgery or an abdominal surgery, that you can start to have irritations to the bladder after that have nothing to do with the bladder lining itself. And so that's where us PTs are really, really important to help you recover after a surgery, to make sure some of that scar tissue doesn't build up around your bladder and all that kind of stuff. So I highly encourage everybody that even thinks that they have IC to get checked out by a pelvic physical therapist before
Yes.
Yeah. And
Awesome.
then one thing I
Yes.
would love to touch on. Do you have time? Do you have time real quick?
Yes, yes, we have time.
Talk about most people get talked to about the IC diet all the time.
Oh, yes. How did we not talk about the IC diets? Yes.
Right? So we have like an interstitial cystitis myth series that's both on my account at Nicole Cozine, DPT, and Pelvic Sanity, where we actually talk in depth with accompanying videos on the myths of interstitial cystitis. And this is myth number 4 and a little bit of myth number 5 about the fact that you can easily, as a patient, get diagnosed with interstitial cystitis, and the only thing that you get is that good luck, and here's a list of foods that you can't eat.
Yes.
And that is, I just think that that's just not good practice to do. What we want to do is make sure so that we know that not everybody is the same with IC and their food. And there's a lot of things that can go on that can contribute to why someone should eat one thing and not the other, and vice versa. But there is hope that the average interstitial cystitis person only has about 5 to 7 true trigger foods. And that's based on a really extensive research. So I feel like so many people over restrict their diet, thinking that that's
and that affects their quality of life.
Right. And so that is a big area where I really highly recommend that you don't necessarily just read on the internet about what to do about your food, that you really get either to a good qualified physical therapist or a nutritionist that knows about IC and those things. And sometimes those are a little hard to find. That's why sometimes I feel like we need to start with the pelvic PT first. And usually we have people that we can work with to help you through and find your personal trigger foods so that you don't have to over restrict your diet. And then it takes into account if you also have irritable bowel syndrome or endometriosis or another inflammatory condition, that takes food into account with all of those things. So it's not just IC specific. And I think that can really be a game changer for people to, number one, take the fear out of eating. We don't want that to get good nourishment to your body that's going to enhance healing and decrease inflammation. So that's one of the biggest myths of interstitial cystitis, that all you need to do is fix your diet and your bladder should be better. And that's just not how this condition works. So,
like if you went to the dentist and you had a cavity, they're not just going to give you a list of foods not to eat. Okay?
Right. They don't eat sugar. It's like we still have to address the cavity, right?
Exactly.
And there's plenty of people that eat sugar that don't get cavities. So it's like it's so individual. And I think that that's one of the biggest myths on the internet that you read. That's the first thing that comes up. It's usually the first thing that physicians say. And so it's just it's kind of frustrating, and I feel sad for patients because it shouldn't be necessarily like that all the time.
Good. That's fantastic.
Yeah.
And your book, again, so we can find your book on Amazon?
Yeah, so the book's on Amazon. In Australia, there's another place where it is also, so you might have to just look where your common books are sold, but it should be most places. And yeah, so we spent a long time researching all of the current research. The one before my book there was no one that had done a comprehensive look at IC for 20 years. So this is kind of the most up to date, and it includes a lot about pelvic physical therapy and how those muscles can influence it, and the nervous system. So that's where there's some new stuff in there too about that.
I think everyone really would benefit just from reading it and understanding how our bodies work. But any provider, any pelvic health provider, anybody that sees people with pelvises, it's a great resource. And then it's also in user-friendly terminology. So it's not just written on the provider terminology level. A regular person can understand it.
Because we wrote it for patients, but everything that we say in there is backed up by as much research as we could find. So if you don't see a remedy in there, a perfect example is marshmallow root. If you don't see that, that's not in the book. That doesn't mean it doesn't work, but it means that there wasn't enough robust actual research for me to put it in there. So There's a lot of great things. A lot of patients will take that into their physician and say, hey, what about this list? And that's another way to communicate with your physician about IC. If they're not familiar, you can use that as a resource as well.
Very, very empowering to understand. So I'm going to hold it up. I know it's backwards, you guys, but it's the Interstitial Cystitis Solutions. I'll link it in my story. And we have a fun contest. Dr. Nicole and I are going to do a contest with a free urine control shirt and a free book coming up. So stay tuned to our account for that.
Super excited for that.
Yes, I know. It's just a wealth of information, and I appreciate all the time, energy, and love that you put into that book, because I can't even imagine. So thank you for doing that.
Oh, sure. Thank you for telling people about it. I really appreciate it.
Yeah. You are a great resource. Anything else you'd like to share before we close today?
Just a message of hope for anybody that is having symptoms of IC. If you've been diagnosed with IC, if you think you have it, but you're not sure, despite what you read on the internet with doom and gloom days, is that there is hope. One of the first line of my book, it says that thousands of people live happy, healthy, pain-free lives with IC, and so can you.
Yes.
And I'm not saying that's an easy road sometimes, but it can certainly be possible. And it's very likely probable for you if you kind of take your health by the reins and then steer it in the direction you need to go. So,
love it.
So there's hope.
Yes. All right. So make sure you check out your website, pelvicsanity.com. Also your Instagram account, Pelvic Sanity, and then Nicole Cozine, DPT. So, and we'll also, this is going to be on YouTube, so I believe we can include those in the captions on YouTube as well. So thanks again, Nicole. I hope we get to meet in person someday. But
I know.
It's been a pleasure visiting with you again.
I know.
And we'll do it again in 2020.
Wonderful. Okay.
Okay. Take care. Have a good day. Thanks for joining.